Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Today we're looking at the repeatability. Repeatability. So what is this repeatability? It is an attribute of an ideal screening test. So it is nothing but an attribute of an ideal screening test, and it also is called as the reliability, precision, as well as reproducibility. So it is also known as the precision or the reproducibility. It implies that the test must give consistent results when repeated on the same individual or the material. So you'll focus on the consistent results which will when repeated on the same individual or the material under the same conditions. So consistent results under the same condition. Next is it depends on various factors. First is the observer factor. So it is observer. So observer factor means all observers are subjected to variations, and inter-observer variation or within the observer variations are when the single observer takes two measurements in the same subject and at that time and obtained two different results. So it is when an observer takes two different measurements and on the same subject and obtain two different results. Next is the inter-observer. So when you're looking at inter-observer, the variations of between the observer variations are when two different observers obtained and different results on the same subject or material. So two different observers are obtained different results on the same subject. So inter-observer means two different observers are present. Two different. Inter means two different. Two different observers are used and they are on the same subject. So they are minimized by standardization of procedures and intensive training of the observers. So you are minimizing it by the standardization. So there is standardization of procedures and intensive training of the observers and making use of more observers. So you use more observers. Next, what we are looking at is the biological variation. So under this biological variation, it is also known as the subject variation, and they are due to the changes in the parameters observed. So they are due to the changes in the parameters observed in the perception of the symptoms by patients, and regression to the mean and regression to the mean, where there is a tendency of the values to be at extremes of the distribution. The third will be the errors due to the technical methods. So there can be technical methods and errors, and this can be due to the defective instruments, the error use calibration, so calibration errors, as well as the faulty reagents. To learn and grow daily like this, please do subscribe.